When you're sad and blue and everything is putting you down, you know the world keeps spinning around. You know you're not alone.
Yes, with MS, the world keeps spinning around, but you're not alone. Welcome to the 10 Minutes for MS podcast, in which we share information about MS in just 10 minutes. This episode, I'm glad to welcome Dr. Darin Ingels, Doctor of Naturopathic Medicine and MS Specialist. According to Multiple Sclerosis Society, 80% of people with MS have fatigue, and it can last for days or even for 1 to 6 months or even more. Well, what is fatigue and what is the cause of fatigue and how to manage fatigue? We're going to invite Dr. Darin Ingels once again to our show and understand about fatigue management. Welcome, Doctor, to our show once again.
Oh, thank you for having me back, Ritu.
It's a pleasure, Doctor. Doctor, can you please tell us a little about fatigue management? Because we know that majorly everybody complains about fatigue. So what is fatigue, and are there any kinds of fatigue in MS? And how can one actually manage it properly in their daily lives?
Well, fatigue related to MS is very specific, and it's really related to inflammation that's occurring in the brain. You know, there are a lot of different sources of fatigue or causes of fatigue. I think it's important, if you've been experiencing fatigue and you're living with MS, to explore other reasons about why you might have fatigue. The most common reason, again, is really related to this inflammation in the brain. And as the brain gets inflamed, it translates to sort of this generalized fatigue where you feel weak, you don't feel like if you're ambulatory, you don't feel like you can walk very far, you're not motivated to really want to do anything, certainly physical. And so, that translates to then people being very sedentary and not really wanting to do anything. So, for that inflammatory related fatigue, really the way that we overcome it is we help reduce inflammation in the body. And the more we reduce inflammation in the body, that includes our brain, then we start to see the fatigue improve. So, that's a combination of diet, making sure the kind of things we're eating are really anti-inflammatory and not pro-inflammatory. It's making sure we don't have exposure to any external toxins that might contribute to fatigue. So if someone lives, near a plant that's spewing some sort of toxic chemical in the environment. Some people have professions, if you're like a nail tech, or if you're a mechanic and you work in a garage where you're around a lot of petrochemicals, there's certain professions that have a lot of toxic exposure, and those kind of toxins can actually contribute to fatigue. And some of this may be genetic to a certain degree. We know that some people have relatively slow metabolism in their liver. Therefore, when they do get exposed to various toxins, they don't clear them very readily. And as they build up in the body, they can contribute to fatigue. So we're always thinking about what can we do to reduce inflammation in the body? What can we do to promote better detoxification? And between the two, usually we can help, get fatigue under control. But again, I think it's also important to rule out other causes of fatigue. Sometimes, particularly for women, who bleed every month with their menstrual cycle, you can become iron deficient. Iron deficiency can make you tired. If your thyroid's underactive, that can make you tired. If, you've got poor adrenal function, low cortisol levels, that can make you tired. So in my practice, I always go through the process of, evaluating all these other possibilities. Because again, sometimes if it's just a function that your thyroid doesn't do well, we can fix that. That's a relatively easy fix. But if it really is more of this inflammatory condition, that takes a little bit longer to get under control. But it's just important to understand why you have that fatigue and make sure that you're really treating the right problem.
Why is it that MS patients specifically, complain about fatigue? We understand there's another disease known as fibromyalgia, and it's a fatigue-related problem only. Why MS patients have this kind of problem? In fact, 80% of the population is having it.
Yeah, well, again, I think a lot of it comes back to, this inflammation that occurs in the brain. The one thing that we don't always know in real time is, do we have active lesions? Until you get your MRI to see, how many lesions there are, where are they located, are they active or not? We don't always necessarily know that. And, of course, we're not sending people in every month for MRIs for obvious reasons. So, the inflammation in the brain is probably the biggest contributor to MS fatigue. And that's why, we're trying to do everything we can to reduce inflammation overall. And when you get inflammation in the brain, there's a good probability you're also getting inflammation elsewhere. And whether it's in the muscles, in the joints, in the gut, often we'll hear about people having been diagnosed not just with MS, but with fibromyalgia, with chronic fatigue syndrome, with, arthritis, other types of inflammatory problems. So our overarching goal is really, again, to help reduce inflammation in the body. And that's where we just talked about, through diet and all these other means to help get the inflammation under control.
So, doctor, if we talk about diet, we say we have to have anti-inflammatory diet. So what all can we include in a diet?
Well, first and foremost, if you're someone who eats a lot of processed food or junk food, you got to get rid of it. All these foods tend to be very pro-inflammatory, make inflammation a lot worse. If you're drinking a lot of soda of any type, you got to cut it out. Anything that has a high sugar content, high sweet content, has the potential to be pro-inflammatory. And even to a certain degree, people who eat a lot of meat, meat itself, as it breaks down, can lead to a lot of these omega-6 fatty acids, some of which are pro-inflammatory. So what it ends up being is really eating mostly a plant-based diet. Most plants out there tend to be very anti-inflammatory. So eating, vegetables, lots of garlics and onions, a lot of these sulfur-rich foods actually help encourage better liver detoxification, are anti-inflammatory. So, again, if you kind of look at Terry Wall's diet, that's how she kind of built it out. And it really is, again, designed to be an anti-inflammatory diet. One of the things I work with in my practice is I like people to check their pH, their urine pH. We know that the more alkaline your urine pH is, that gives you a better sense of your overall body cellular pH. And we know from the research that the more alkaline we can keep your tissues, the less inflamed you're going to be. So this is something anybody can do. You can go to your local pharmacy and buy these pH strips. And about 30 minutes after you eat your meal, go pee on the strip and look at your urine pH. And we want to see it 7.2 or higher. And that'll be a really easy, inexpensive way to gauge, how are you doing biochemically? And if we can keep you in a more alkaline state, that's going to give your cells an opportunity to be less inflamed. It also gives the cells better opportunity to repair themselves when they're in an alkaline state. With the exception of your skin, your stomach, your bladder, and for the women, for the vaginal area, which is very acidic, that's designed to protect against outside invaders. The rest of your body, more or less, is alkaline. So again, the more we can keep your body in that correct pH, it gives the cells better opportunity to heal. And again, ultimately that translates to better cell function, better mitochondrial function, and ultimately better energy. So getting that inflammation down will definitely help get people's energy back up.
Can a person having fatigue work out as well?
Absolutely. And you just have to gauge your fitness level with your energy level and make sure they match. There's no benefit to overextending yourself to the point where, you do any kind of physical activity and then you're wiped out for the next 3 days and can't get out of bed. That's not beneficial. So you'll always have to play around with, whatever activity you do, how much can you do, how long can you do it before you get to the point where it really starts to affect you in a negative way. We always want that movement to be positive, where you're able to do it. You feel pretty good afterward. It is not uncommon after doing some activity that you might have to rest for an hour or two, but your recovery should be pretty quick, and that's okay. But if it's taking longer than that, where it takes 6 hours, 8 hours, several days, then whatever you did was too much, and you'll just have to scale it back a little bit. But it's really important that you maintain your mobility, because ultimately that's what keeps your disease from regressing and keep you moving forward.
Right. So if a person wants to be away from medicines and treat fatigue normally or naturally, then a person should take proper diet and also continue to do exercise. And yes, sleeping well is always there.
Always.
If a person is fatigued, how many hours of sleep would you recommend?
I find most people with MS need more sleep than other people their age. So it may be anywhere from 7 to 10 hours, depending on your age, but it's probably going to be more than you think it is. The other thing with sleep that's important to understand is the timing in which you get your sleep is critical. So getting 7 to 9 hours or 7 to 10 hours by itself, when you get those 7 to 10 hours, is really important. We know that your peak sleep is probably going to occur between 9 p.m. and 3 a.m. So as much as that window that you miss, it's going to be harder to catch up. So going to bed from 9 p.m. to 6 a.m., you can say, well, okay, well, I slept for 9 hours. That's great. That's good. But sleeping from midnight to 9 in the morning, it's still 9 hours, but the timing of it's different, and your quality of sleep will probably not be as good. So it really is important to try and get to bed earlier, because we'll get more of an opportunity to hit that window where we can get better deep sleep. So, our bodies are really designed to sleep with the sun cycle, and as much sleep as we can get earlier in the evening is actually better for us.
Seeing the lifestyle of people today, it's difficult to follow the sun cycle. But
very difficult.
But we all have to, if we want to really get better and treat ourselves properly, we have to follow that cycle.
Exactly.
Thank you, doctor, for all your advice today. It was a wonderful session and it was wonderful talking to you.
Great. Thanks, Riju.
Thank you, warriors, for being with us. I hope you found this session useful. We will be back again next week with another informative session. So don't forget to subscribe and reserve just 10 minutes for MS.
No, you're not alone.